again. Today we're going to talk about the lymphatic system. The lymphatic system works closely with other systems to try to help your body maintain homeostasis. Now, it sometimes gets used interchangeably with the word immune system, but immune system is much bigger than the lymphatic system. The immune system is a bunch of systems working together to stop foreign invaders. Now, what exactly are these problems that are caused within our body that might cause us to have to figure out how we're going to maintain homeostasis? We know that there are inherited disorders. These are things that are caused by changes in our DNA, and we can't do anything about that right now. We're working on it, but for right now, all we can do is compensate by medicine. There's also injuries. Little injuries, your body could probably deal with right away, like a cut. Larger injuries might need medical intervention of some sort. So if you break your arm, you might need a doctor to set your arm and cast it. There's also a breakdown of the system due to age. So the body and medicine try to help with this, but at some point, if your body stops maintaining homeostasis, that is when we die. There's also a disruption of homeostasis by the environment. So things like smoking, alcohol, pollution, all take our body away from its normal steady state and disrupt homeostasis, and we have to deal with that. But the one we're going to focus on today is sickness from pathogens. These are things like viruses, bacteria, fungi, parasite, and these bad guys are all things that your body is going to kick into action and go after, and that's what our immune system does. Sometimes we'll use a medical intervention to help our immune system out. Now, the immune system is kind of at war with these outside invaders. So if you can imagine an army at war, there's always going to be different lines of defense. And the first line of defense are the first group of individuals in the army that are facing the invaders. Now, this is non-specific. They don't care who you are or what kind of invader you are. They're going to deal with you the exact same way. This is how our skin works. It's part of our integumentary system, and again, it's keeping stuff out. It's a physical barrier. The mucus of our body, like the snot in our nose, tears, earwax, all these things are also going to keep all invaders out the same way. The cilia in the respiratory system, a lot of time we'll find smokers have very coated cilia. These cilia are trying to gather up as you inhale any of the pathogens or foreign particles that are in the air you inhale and gather up and keep it from getting into the bloodstream. The gastric juices in the digestive system help us with our food. The thing is most of the stuff we eat is probably covered with pathogens of some sort. And so these gastric juices try to attack those, again, to prevent it from getting into the bloodstream. Now, the second line of defense is also nonspecific, meaning saying, I don't know which kind of pathogen you are, but I'm going to attack you all the same way. A lot of times with that second line of defense, we're talking about an inflammatory reaction and endocytosis. Inflammation is characterized by this redness, swelling, pain, and heat. If you've ever gotten a cut in your arm and it got a little infected, you might have noticed the red and swelling in that area. That is your second line of defense. Now, endocytosis is where the white blood cells then go in. Again, they don't necessarily know what kind of invader you are, but they recognize this is not part of my body, so I'm going to engulf it and break it down. So we talk about the immune system, but as you can hear, the inflammation, that piece, and the circulatory system are as big in terms of the circulatory system with the white blood cells and the integumentary system with the skin. Two systems very involved here. Our third line of defense that we're going to really focus on today is the lymphatic system. And it's different because it tailors its reaction. It says, I know you, I've seen you before, I know how to fight you. So this lymphatic system has certain structures. And if you look at a diagram of the lymphatic system, initially you might say, hey, this looks like the circulatory system, because just like the circulatory system, it has vessels. Now, these lymph vessels are an entire system all throughout your body that carry a liquid called lymph, and that lymph is going to scoop up these bad pathogens and try to get them to things called the lymph nodes. So if you take a second and feel your throat, you might notice you have lymph nodes right in your throat. You also have them in your armpits and right here, and you have them in your hips. So anybody who's ever had strep throat before knows where these knows about these lymph nodes. They've probably felt them swollen. Now in these lymph nodes, the pathogens are filtered out, and we try to keep it out of the bloodstream. The thymus and the spleen are also a portion of the lymphatic system. These structures are glands that store these important cells that say, hey, I know you, I've seen you before, I know how to fight you. Those are stored and created and sent out from the thymus and the spleen. Now, exactly how does this third line of defense work? Well, this is where these cells, we have these cells that recognize the invaders because they've seen you before. Well, where does this recognition come from? And the recognition can come from immunity from your mother. This is called passive immunity, and this happens in the third trimester. So when I was pregnant with my girls, in my third trimester, they got all my antibodies. And so I actually got chickenpox as a child. So I have the directions on how to fight chickenpox. And I was able to pass those on to my daughters for a short period of time. That immunity only lasts a few weeks after birth, or if the mother nurses, it's only going to last about the length of the time that they're nursing. Now, I am going to stay immune to chickenpox because I was actually exposed to chickenpox. My body says, hey, I've seen you before. I fought you once before. I know how to fight you again. So if I get exposed to chickenpox again, it enters my body. My body takes care of it. I probably never even realize it's happened. But my daughters, they don't have that immunity anymore. So we got them the chickenpox vaccination. Now, the way that vaccination worked is it was injected in their arm, and this was a weakened version of the chickenpox vaccine. So they didn't actually ever show any symptoms, and their body figured out how to fight this weakened version, but the actual chickenpox pathogen is the same shape as the vaccine, so the body fights it the same way. And so if it already knows how to fight the weakened version, it's going to be great at fighting the full-fledged version as well. At this point in time, I am done with my notes. I'd like you to take a second and write about how does the lymphatic system work to maintain homeostasis for the entire body, and what systems does it work with and specific ways that they work together. Have a good day.